And did you know that almost 1/3 of all middle-aged men in Singapore have obstructive sleep apnea? Hi, I'm Dr. Valerie Tay from the Aspire Ear, Nose, Throat and Snoring Clinic. Today, we're here to talk to you about obstructive sleep apnea. Now, breathing is central to sleep. When we sleep at night, we actually have to have a regular flow of a rhythm in terms of our breath, and it does change with each stage of sleep. When we do not have enough oxygen in the body, and as carbon dioxide builds up because we're not breathing well, what can happen is that it activates the respiratory center of the brain to wake us up to breathe a little better, to improve the oxygenation in our body. And the most common issue when it comes to sleep-related breathing disorders would be a condition called obstructive sleep apnea. What happens is that the airways close up, patients are not able to breathe, and as a result, the oxygenation of their blood reduces, and it causes them to wake up and have interrupted sleep. Obstructive sleep apnea is a condition in which the airways close up when you sleep. It causes a sound, which is what we all recognize as snoring, and as a result, your brain has to wake you up to breathe and to improve the oxygenation in your blood. Well, for obstructive sleep apnea, it doesn't only affect your day-to-day life in terms of your energy in the daytime or how you concentrate at work, but there are a lot of other effects in terms of your cognition, your memory function, as well as other medical conditions. It has been shown to put patients at higher risk of heart problems, diabetes, high blood pressure, and even strokes. So obstructive sleep apnea, while it sounds like it may just be a condition that affects your sleep, but there are actually a lot of other implications on your health as well. Typically, the patient's bed partner is the one that brings the patient in, because the bed partner is the one that's more affected by the snoring. And they actually will observe that their bed partner chokes and wakes up in the middle of the night. And pretty frequently, these patients will also have to wake up to go to the bathroom to pass urine. Morning when they wake up, they may complain of having a dry throat, and they may say that they have a morning headache. Typically, they feel unrefreshed when they wake up. They don't feel that they can concentrate well at work, and many a time they may also fall asleep when they're not being particularly occupied. For example, if they are traveling on the MRT or the bus, if they're after lunch, for example, and they're just looking at the computer screen, they may actually take naps as well. So these are some of the symptoms that patients may experience. For the treatment of obstructive sleep apnea, there are three main components. So the first is weight loss. Because obstructive sleep apnea is very closely linked with obesity, many patients who have obstructive sleep apnea are also obese. So we would advise them to exercise and perhaps consult a dietitian to help them plan the diet. The second option to consider would be that of a continuous positive airway pressure machine. What the machine does is to drive in air at high pressure to keep the airways open so that it doesn't collapse when they sleep at night. Now, this may be a little bit uncomfortable, and some patients may find it cumbersome, which is why many of them, if they lead a very active lifestyle and they have to travel a lot, they would opt for the third option, which would be surgery. Now, surgery is tailored to the patient's anatomy. It depends on where their level of obstruction is in the airway, whether it's in the nose, do they have a deviated septum, or do they have large tonsils in the throat such that they need a tonsillectomy, or is their palate weak and do they need surgery to stiffen the palate so that it doesn't vibrate so much when they sleep. Well, I would say that overall for obstructive sleep apnea, what's very important is that can be modified would be weight loss. If you are obese, then your risk of obstructive sleep apnea is very high. If you lose weight, and I have seen patients who have lost a significant amount of weight, and if they achieve a normal BMI, their obstructive sleep apnea actually resolves. But other than that, in terms of the anatomical structure, unfortunately, that's not something that we can alter. So there's no preventive options if the patient's anatomy predisposes him to obstructive sleep apnea.